Good afternoon, everyone. First of all, I'd like to thank Dr. Umesh Khanna, who always encourages the young nephrologists to share their views. We are at such an age that neither we can call we are very senior nor we are very junior, but yes, we have gathered some few points while traveling the path of practice, and that I'd like to share with you. This talk is completely from heart. There is no double-blind study, there is no RCT, there is no comparison, but yes, whatever we could gain, that we are trying to discuss. A very interesting survey conducted by Forbes revealed that only 6% doctors are happy. Another survey done by the Indian Medical Group showed that more than 65% of Indian doctors are not happy, and over 61% doctors would not want their children to join this profession. This is in fact the scenario now. So why that is so? So success has a different definition, but the true definition by Jack Nickel is success is defined in units of fun. It's all about being happy. So whether you are in private sector, whether you are in teaching institute, whether you are a teacher, a private practitioner, earning money, earning average money, ultimately it boils down to the final point that are you happy doing whatever you want? And if that is so, then it hardly matters. So in fact, you need 3 skill sets to be a happy doctor. Medical school provides only one, and that is a technical skill. No human skills and no business skills. And that is why probably on your path of practice we go wrong, because these 2 things are never taught to us, and we try to learn only with time. It's not a very bad scenario. Now we heard that there is overcrowding especially in developed areas, and there are probably more nephrologists coming up. This is the figure that India, the figure is that there is less than 1 nephrologist per million population, and this is the latest figure of 2022. In fact, the growth which is expected in India in 2020, it was a turnover of $93.6 million, and it is likely to go by 2027 to $102.7 million. So of course, if the entire nephrology as a subject is growing, it doesn't matter whether you are crowded, less crowded, there is ample opportunity for everyone, and it should not be a dismal thought or a negative thinking at all. So certainly there is more demand, less supply. Yet we do see that 1 patient is pounced by 5 nephrologists. And what is the reason for that? So this was a survey conducted in South Africa, where they found out there is maldistribution of nephrologists. This was a study of 128 nephrologists, 92%, and they found that most of them were in few provinces, and there were provinces where there were no nephrologists at all. And in fact, in every headings, like there was poor career planning, need to change nephrologist training, that was the outcome of this study, remuneration pattern and so on. So in short, the maldistribution is something which we have to address. How we can resolve this? Often there is a thought that if I am staying at one particular area, my practice area should be a kilometer away. In fact, in Mumbai, there were now different nephrologists who adopted this model of office being far away from home, and they did wonders. There are people who are staying in central suburb and practicing in the far western suburb. They in fact travel maybe around 10 kilometer or 20 kilometer a day, but since they never had any competition there, right from day one, they could set up their practice. So I'm talking about people who are in Mulund and Bhandup, this is one of the suburbs in Mumbai, and went to Dombivli, Kalyan, Karzat and Kasara, where there were no nephrologists at all. In fact, those people were eagerly waiting that who would solve our nephrology cases, and they could set up. So please remember this in point, that in your practice area need not be close to your home. Again, these are the different headings which are taught in our training program, and we hardly do anything like PD catheter insertion, ultrasound understanding, vascular access ultrasound, and so on. So naturally, now we know that even ISN has started this program where you can learn those things which you never learned in your training program, and you can do those small workshops or a particular period of time and learn these aspects, because when you want to be a successful practitioner, you'll realize that the money comes from all these headings. If money is the criteria to call it a success, then it need not be just the clinical evaluation. You'll get money from procedure, you'll get money from all these insertions of catheters and PD catheters, even ultrasound if you can do of yourself. There are people who are doing fistula by themselves. Now, we have some few nephrologists in Mumbai. In fact, their fistula practice is more than their clinical practice. Because all of us are referring to them and they do something like 6 or 7 fistula a day. And now they have thought that this is probably the way to go ahead. So that one should be. Of course, as we've already discussed, that your priority and options have to be decided first. So same, if you want to be a full-timer, you want to be a private sector, corporate sector worker, entrepreneur. So all that we already discussed in the past. And before you embark on this practice path, be clear that what is your priority. Because unless that is clear to you, then probably you will not get confused, not waste many important years of your life in just establishing your practice. Because if your goal is clear, right from day one, you can start. So these are the 3 areas which we normally know, that either you want to do an independent nephrology practice, or you be a private practitioner with corporate attachment, or maybe an entrepreneur. Entrepreneur world looks very big, but it's easily doable. You just need the like-minded people, one in a group. Everyone would contribute different skills into becoming an entrepreneur, and it is doable. So there are now various chains. Now I heard that almost there are 17 or 18 dialysis provider companies, which were only 1 or 2 in the past. So everyone has in fact started this game, and everyone need not be Nephro Plus, but then there are people who have done 30 centers with them, 50 centers with them, and actually they are growing, and as the dialysis market is growing in India, most of them would do well in future. So it takes courage to live your dream and bounce back up when you have been knocked down. Your dreams give you the energy and inspiration to live a great life. So that's why it is very important to keep dreaming and keep achieving that. So medicine is an apprenticeship profession. You learn to be a doctor by studying doctors. Like we were fortunate enough to have our teachers. Like I did my nephrology under Dr. Bharasha sir. And 2 things which I never forget even today is the protein requirement of a CKD individual. He always teaches that, why they should be on protein restriction. If you calculate their, protein nitrogen appearance in the urine, then probably they'll all be malnourished. And now whichever patient comes to me, when I say, aap kha sakte ho sab, then they literally are in tears, because the fine nephrologist must have told them that you should be on protein restriction, you should not eat palak, you should not this, so and so. Sir, hum log sirf 3 cheezein kha rahe hain. Lauki, ek chapati aur sukhi roti. So naturally, once we tell them that no, you are likely to eat everything, you don't worry about your CKD and things like that. So the right teaching, we are fortunate enough, and that actually helps. So you always mimic your teachers, you always mimic your seniors, and that's how we have learned on nephrology and been practicing. Though I have not done my studies under Dr. Kher sir, but umpteen number of lectures I attended him whenever he used to deliver that in conferences. We used to call him as a deliverable in your Apix Kidney Care program also. And whatever he learned from them, that is all stored, and that is what, whenever the right opportunity comes, we try applying them. So let your actions be louder than your words and your dreams bigger than your fears. Start working to fulfill your dreams. Otherwise, someday someone will put you in work to fulfill their dreams. So just be on clear path that yes, this is the thing which I want to achieve. So be clear with your mission, vision and aim. Whether you want name and recognition, name and money, you want to be a good orator, you want to be a good speaker, you want to do more research, and embark on that path. Once you are very clear that this is my aim, then we would. Let's now talk about the tricks which you are talking about earning money from nephrology. Many of probably you would think that consultation, maybe OPD indoor references, procedure, dialysis revenue, and kidney transplant. That's the major headings by which you're going to earn. But you'll be surprised to know that even all these other parallel headings would also give you good amount of money, like pharmacy outlet, labs, ambulance service, ultrasonography, which you can own, food services to your patients, equipment trading, home care, behavioral therapy. No, all those sections are developable, and once you develop that, you will get money from that. So never ever think that nephrology is equal to this consultation, transplant, and dialysis. All these parallels, because ultimately patient does need a single solution under one care. So if you are able to provide all this, then actually it's easy for him. Networking is extremely important, and the first word I have used is wander, and you will wonder by response you get. You need to wander to begin with to increase your catchment area. And then of course, PROs people keep, then you have your GPs, physicians, and urologists who probably refer to you. You have CMEs for them. But a direct connection with patients, and as Sony said that, no, if your patient is impressed upon you, you don't take any referral GPs, because the patient will try bringing patients, and you'll always be surprised that whoever comes in and you say that who has sent you, he'll always take the name of the patient. That so and so Deshpande was treated by you and he recommended your name. So you really don't require any referral other colleagues. So camps, screening, okay, even preventive nephrology program you can start, patient education programs you can start. All that would basically be your catchment area of practice. So there are people who first, maybe weekend, they travel in their 15-20 kilometer area, so they are wandering, and maybe once in a month they go to a distant place, like maybe the next state also. I still know my friend who used to go to Gorakhpur, Dr. Atul Ingre, and I'm sure that he did so well because there were no nephrologists that time, and even today, those patients keep searching, come to Vashi and show him, because the channel is already created. You don't have to naturally be there now, but because the channel is already created, they know that he was one of the good nephrologists, so naturally they come and show it to him. So wandering would certainly help you. Most important, which is in fact at times lacking, is the behavioral aspects, not of patients, but of nephrologists. No, we always hear some stories that someone went to a particular consultant, he threw away the file. He scolded us. He said that, what are you, you're not up to the mark. And these naturally are the factors by which, no matter he may be a very intelligent, very big nephrologist, but those interactions which are a behavioral aspect would disturb patient, and they'll always seek attention of another doctor. So most important is keep cool, never shout abuse, never scare patient, because I still hear some stories that, oh, creatinine is 2. Everyone know that if creatinine is 2, his GFR is less than 50%. You do not have to talk to them. You can say your kidneys are compromised, it's doable, it's controllable. When you start using scary words, you will die. No, you will be on dialysis. Next 2 years, your GFR will decline. This is all theory given in Brenner and Schreier, but need not have to be shared with the patient. There only you can in fact do as much counseling you can do. So in transplant, I always use this technique that, it's a donor will always say that if I want to give one of the kidney, can I be okay after that, or I would come on dialysis? Say that there are 2 kidneys, one you donate, that means you're not going to live on 1 kidney. It will undergo compensatory enlargement, and it will do the job of 2 kidneys. So ultimately, you're not donating anything. You're just changing your methodology. For each such sections, you create your own metamorphical example and explanation so that the anxiety is allayed. So I always said, how is your practice going on? Say 100%. 100%, 60% mine, 14% bounced by others. Okay? So at least that one would be able to prevent if you are able to concentrate this. Be compassionate. So that's most important. Be compassionate to your subordinates, technicians, housekeeping, nursing staff, RMOs. These all headings will provide you patients. In fact, 30% of the OPD at some stage would become a referral patient from your own group. Because someone's uncle, someone's aunt is suffering, and they know that you're a good nephrologist. Naturally, you don't have to search patients, because those patients will keep coming to you. Enhance your skill in your hobbies, because there is something called as burning out syndrome. All private practitioners say that they are not able to pursue academics because they are too engrossed with your patient work. So naturally, if you keep doing work, maybe 14, 16 hours a day, burning out syndrome would be very common. So naturally, either you have some hobbies in music, reading books, sports, maybe cooking, all that you try to pursue. At least weekends, you try to relax by your own, do meditation, yoga, etc. Otherwise, burning out syndrome is the usual outcome. So, but this is also important. कुछ तो बात है उसमें. अच्छा क्रिकेट खेलता है, कराओके सिंगर भी है, बोल बच्चन था, प्रैक्टिस छोड़ के सब में बाप है. So of course, that one should not neglect, that you have to also consider in your academic skill, especially that's a challenge in private practice, because if you are not reading books, if you are not in connect with the latest, then naturally you will fall behind and you will not be able to catch up the concept. So trajectory of time and development of practice. At 29, 30, you become nephrologist. 30, 33, you probably go for fellowship. 33 to 38 years, probably go for private practice, local, wandering, corporate, whatever you call it as. If you want to really become entrepreneur, start at that age, 39 to 43, and not at 58 or 62. 44 to 50, you try to develop group practice, because that's a time where you already established, you can pass on this legacy to your fellow mates, juniors. Then you try concentrating on CMEs, orator, teaching, so that you are always in touch with the academics. At 51, 60, you probably think about starting a foundation, be an active member of nephrology societies. Beyond 60, try doing only stress-free, non-competitive practice at your terms. That should be your goal of trajectory. Of course, these are the 4 methods of earning money. You can be having a medium charge but moderate volume in your own. If it's charitable, then there will be a low charge but high volume. Each section is going to give you money. Remember that, and that's why there is nothing wrong if all 4 types of attachments you have and you're working, because ultimately money is important and you'll naturally get it from some source. If you're interested in seeing few patients in specialty clinic, like those people do in UK, if 7 patients they see, they say, oh, today I had a very heavy OPD. And that in Sion Hospital, and okay, they say that 47 patients were the admission in just last 12 hours. So the difference is how many patients you want to see. So unless you give time, then probably you do justice with the patient. That's why it's important to see only few patients so that you do with the patient. But yes, a very new segment is coming up called as preventive nephrology. All our seniors always keep harping and saying that we don't do anything in preventive nephrology. The incidence is increasing, prevalence is increasing, but we don't screen patients for hypertension, diabetes, microalbumin, and so on. Once you adopt even part of your time to preventive nephrology, you'll start screening a large population because they're all normal. You're just screening them for early involvement of CKD or risk factors getting evaluated. So think over that preventive nephrology is one subject which can always inculcate in your practice, and unless we do, who else is going to likely to do anything in the preventive nephrology group? We already see that there are different aspects, but a jack of all trades is a master of none, but still better to be a master of one. Because I still remember there are patients which are very difficult electrolyte patients, some difficult hyponatremia, some forms of acidosis, and there are only few names where we refer, because it's too much to remember about anion gap, RT, and so on, but they are so perfect in electrolyte management that these patients are referred. So one such name about one disease, if you can create, then of course that practice will be added. One aspect is about the representatives which we see, medical representatives. This was a very good survey conducted that 68% see once in every month, 27% twice a month, 5% see 3-4 times a month. The usual time is given to any medical rep is 5%, 5 minutes, 5 to 10 minutes, or rarely about 10 minutes. So usually the approach is that these are not supposed to be entertained. My first 3 dialysis centers, which we started in under Navnath Healthcare, came from medical representatives. Because the reason being that they are the only one which knows what is happening across the globe. I probably would know only what is happening in Mumbai, but I do not know what is the dialysis necessity of Assam. And they said, there are 3 nephrologists there, why don't you think about putting a dialysis center if you are a dialysis provider company? And that's how that knowledge, the medical representatives can always give it to you, that what's happening in the entire globe about the nephrology market, and you can learn few things about them. How to impress upon your customer, which is a patient. So give enough time. First and foremost, allay their anxiety, explain, and explain. Keep informatics ready. Then convince for transplant whenever there is a right indication. Dietary advice, you have to learn the actual dietary requirement and not what is given in the books. Understand limitations for lifestyle modification. Many times when we keep harping that your weight is not coming down, you still smoke, you still alcohol, they say this is nagging. And they'll again change the nephrologist because they are never interested in changing their lifestyle. So do understand that the lifestyle modification is not everyone's game. We already would probably have lectures on wealth management. Dr. Dedia sir has already come and is going to talk about wealth management. It's time to give back to society when the right time comes by formulation of foundation, charitable trust. You'll then carry out free camps and then enhance your practice further, because all that is going to add to your name. So it's one small step for man, but one giant leap for mankind. So always be generous when the right time comes. Group practice, again, we are going to talk about it. So I am afraid you'll have to stay late night. I want you to attend the talk on work-life balance. So that's the actual situation of work-life balance, okay? That no one is able to maintain this work-life balance, okay? And it's very important to, in fact, it's equally for male and female. Like for a male, he has to go to gym. There are continuous talks from the patients. He has to think about his livelihood. He has to think about his home. And for a female, naturally, there are again child upbringing and so many other factors. So ultimately, what it boils down to is be a happy doctor and happy practicing. Thank you.
No, I think they're listening everything, but they don't want to ask any questions.
Yeah. Yeah, so we try to avoid medical jousting as much as possible. In fact, we should be very neutral. We try to just pick up the points of the previous nephrologists which have been positive. Even if there are some gross error which are visible, We should just neglect that. They say, generally you can sum it up by saying that these complications, though rare, can happen, or whatever has been told to you is not completely wrong. So please avoid medical jostling. That never helps. That temporarily gives an elated mood that, I have downgraded someone and probably that is the reason I am a bigger nephrologist. But in the long run, it would be a big mishap. So medical jostling is something which has to be not allowed at all.
So advising fistula, making them prepared psychologically to accept the things that, well, it is there in your destiny, but we should be careful not to do it as early as possible, but to delay it, what they like mostly. No one likes to be on dialysis. And you can open the prospect of various forms of dialysis. So I remain little open with patients, and I feel that that's good, that you remain open with patient. Little talk about what he is going to have in future, just to make him more a part of obedient follower of what you see. Too creatinine, just nothing. Maybe a diabetic is not convinced that at what juncture he is there. So little bit counseling about.
Yeah, so basically, first this conservative management, when people say that, are you going to give these medicines for lifelong? So say, no, it's not for lifelong, it's for long life. Okay? So then the conservative management
I think he's just giving us the tricks. That doesn't mean we are not going to inform them about it. I think a few comments from chairperson, then we'll have to close this session.
So excellent talk. The data was about, especially the number of nephrologists per population of this country was excellent, because I think the problem with most of the young nephrologists is when we pass out, we generally first thing is either go to do our fellowship and all, and then come back and work in big cities until unless you have a setup to fall back on. So what would be your tricks for younger nephrologists, and that will encourage them to move to maybe second, third tier cities and try their entrepreneurial skills there, instead of maybe coming back to the oversaturated cities?
Yeah,
I think Vilas Nayak is the best person to answer it. He is sitting by the side.
I'm going to have a complete talk on the same, going to a third tier city, and how do you start your private practice or transplant program. So I'll come to that very soon.
So for the interest of time, we are just wrapping this up, but thank you so much.
Thank you.
This is a wonderful session. The last one for this session is again a panel discussion on group practice in nephrology. And to chair the session, thank you. May I call upon Dr. Amit Langote and Dr. Bharat Shah, sir?
I think Dr. Bharat Shah is just come. May I request Dr. Prabir Rai Chaudhary also to be on the